WDD. What is WDD? The World Diabetic Day. This is the largest diabetic awareness campaign in the world, yeah, and the targeted audience is at 1 billion people across 160 countries. So it falls on 14 November. So today is 13 November. We are doing it a day ahead of that. And today's webinar, the virtual health webinar on diabetics awareness, is put together, organized by the Lion Club of Singapore, Clarke Quay, and it is supported by Diabetics Singapore. We are very honored. We are very happy that Diabetics Singapore is, willing to support us in this event. Before I start the program, let me introduce myself. I'm the organizing chairperson and the MC for today's event. My name is Josephine Tan. So Lion Club Singapore has been active in many social projects in Singapore and overseas for the past 25 years. Our signature club projects include the weekly vegetable collection charity project that we do for the needy homes, yeah, and old folks home, and the need for those who are in need. And our second signature project also have hair and nail project, which we do it for the elderly in the Clementi estate and the Mei Ling estate. And also National Day Bake-In project, that is also one of our signature club projects. And last but not least, we also strongly support World Diabetic Day, World Sight Day, Befrienders and Lion Homes Flag Days, and other activities such as visiting the orphanage, the old homes. Yeah. So to find out more about Lion Club Singapore, Clarke Quay, you are welcome to scan the QR code that is on your left, on the screen on your left, to find out more. Maybe you'll be interested to join us to contribute to these social projects. Well, before I start the program rundown, let us talk a bit about the house rules for today. Okay, when our guest speakers, they do the sharing, you may jot down your questions in the Q&A button. The Q&A button you can find either on top or below your screen. Okay, if you cannot find it, you can also type in the chat room, but try to type in the Q&A, because so that you might not be missed out by myself. You type the question that you would like me to submit to the guest speakers today, so they can answer your question at the end of the sharing. This webinar will be recorded for internal record keeping, and it will be uploaded to YouTube for future rewatch. Okay, participants, you are reminded to stay throughout the event, because at the end of the event there is a feedback QR code for you to scan, a few simple questions for you to complete to answer. Yeah, and at the end of the event today, we are going to pick 5 lucky winners. Okay, we will contact you within a week to arrange delivery of the lucky draw gift to your doorstep. Thank you. Okay, today's program is very interesting, very exciting as well, and it will be definitely very educative for the audience today. So your time will not be wasted. Our first topic, our first keynote speaker will be Dr. Warren Lee. His topic is going to cover the war against diabetic. Sorry, there's a misspelling, yeah? The war against diabetic in the pandemic period, during the pandemic period. And then after Dr. Warren Lee, the other 2 guest speakers are Ms. Juliana Lim. She's the chairperson for Diabetic Support Group of Singapore, and also Mr. Kenji Miraso. He's doing the co-sharing with Ms. Juliana Lim. Yeah, and he's also one of the very active volunteers at the Diabetic Singapore Support Group. Okay, and after the 3 speakers, we have key takeaways key points that I will share with you. And also we will share out the QR code, the feedback QR code link for you to scan and answer the few simple questions. And then after that will be, at the same time, if you provide us your email address, your contacts, we will do a lucky draw and pick 5 lucky winners. And we will also send you the today's webinar's recorded link, the record link, yeah, for you to rewatch later. And at the end will be the Q&A. We will open for the guest speakers to answer your questions regarding diabetics and related topics, okay? So without further ado, let's come to our first topic. Where are we in the war on diabetics and the impact of COVID-19 on people with diabetes? Okay, so our today's guest speaker is none other than Dr. Warren Lee, advisor and past president, Diabetes Singapore. And this is our speaker's profile. Dr. Lee graduated with MBBS degree from NUS in 1985. He's trained in pediatrics in Singapore, and he leads endocrinology service, Department of Medicine, KK Women and Children Hospital in the 2000s, early 2000s. He is the chairperson of MOH Advisory Committee on Adolescent Services in Singapore. He's head of General Ambulatory Pediatric Adolescents in KKH in also the 2000s. And he started the first modern children's diabetic camps run by Diabetic Society of Singapore in the early 2000s. And Dr. Lee also started Diabetic Society of Singapore Complication Screening Center in Hong Kong, GRC, between 1996 and 2004. He's an advisor to members of International Executive Board of Diabetic Federation. He's the chairman of IDF Western Pacific Regional Council, 2002 until today. He's the International Society Pediatric Adolescent Diabetic Council member in the early 2000s. He's a member of Disciplinary Committee of Anti-Doping Singapore, member of National Council Against Drug Abuse. He's also the member of Standing Committee for Research and advocate for the Children's Society. So without further ado, I'm going to invite Dr. Lee to start his presentation. Thank you. Dr. Lee, we cannot hear you.
Hello, can you all hear me now?
Yes, thank you.
Okay, good. Let me share my screen with you all. Just a minute. Can you see my screen? Can you all see my screen now?
Yes.
Okay, good. So this is World Diabetes Day 2021, and the Lions Clubs and Diabetes Singapore have asked me to speak a little bit about the war against diabetes in Singapore. We are in the midst of the COVID-19 epidemic. How are we doing? Well, firstly, to be thanks to the Lions Club of Singapore, Clark Key, for inviting me, and Diabetes Singapore for its support of this meeting. I'm quite happy to share with you all. I'm still a pediatrician in private practice. I see patients with type 1 diabetes primarily, but some adults and older adults with diabetes as well in private practice. How common is diabetes in Singapore? I think sometimes we don't really get a feel of the numbers. But while we say that 1 in 14 Singaporeans currently have diabetes, it's a question of an age group thing, because 1 in 3 Singaporeans will eventually develop diabetes as we get older. Even though when you're younger, it's less than 1 in 1,000, then it gets to 1 in 100, then As you get into the 40s and 50s, it's 1 in 10. At about 41 in 5. By the way, that time you're about 50. 1 in 3 by the time you get your seniors card, right? So that lots of people will get there eventually. And another 15% of Singaporeans actually will have pre-diabetes. And again, the pre-diabetes, the biggest group is really up in the 40s and the 50s, because by the time you're in your 60s and 70s, those who will get diabetes will get diabetes. Some people will not get diabetes at that point in time because they will have gotten other things or they're not around. Now, in 2016, then Minister for Health, Mr. Gan Kim Yong, announced the establishment of a new diabetes prevention and care task force. And that was the start of the war against diabetes, because he said he wanted to help Singaporeans live life free from diabetes, and for those who are patients, to control their condition to prevent deterioration. Because he noted at that time that out of the 400,000 people in Singapore who had diabetes, firstly, 1 in 3 didn't even know that he or she had diabetes. And of the rest who did know, 1 in 3 had poor diabetes control. And what we mean by poor diabetes control is when the sugar levels are either too high or too low. And while he was saying, well, you know, at that point in time, this is about 4 or 5 years ago, it's 400,000 people. If left unchecked and you follow all the curves, then nearly 1 million people in Singapore will have diabetes by 2050. And that's a huge number of people. That's a huge burden. As we can see, during this COVID-19 pandemic, you can see that when your health system is overwhelmed or under strain, standards will start to dip. And if you've got 1 million people in Singapore having diabetes in about 20, 30 years' time, then either you have to have a much bigger health service, or whoever's running the health service at that time will have a hard time. Because of this, PM Lee also said, look, this is a big priority for Singapore. And in his National Day rally speech on the 20th of August, 2017, PM Lee said, it is precisely because you, the population, are not worried that I am worried. Diabetes has become a serious problem. So he suggested 4 ways for individuals to play their part in this fight. And he was primarily looking at the people who had not yet gotten diabetes, as well as those who had gotten diabetes but didn't know. So one is to go for regular health checkups so that if you have diabetes, you'll find out soon. Exercise more, watching your diet, and cutting down on soft drinks. And of course, he said, the best is to drink plain water. Better still, drink PUB water, right? And not really necessary to drink a lot of bottled mineral waters. So fast forward 4 years later, 5 years later, now this is 14th of April, 2021. And in addressing one of the international organizations, he said, Singapore declared a war on diabetes 5 years ago, and 1 in 3 Singaporeans can expect to develop diabetes in their lifetimes. And therefore, for Singapore, this is a whole of nation effort. And we know when he says whole of nation effort, just like in COVID, right? Everybody gets involved. Tackling diabetes is a major priority for Singapore. Diabetes is an invisible disease. It does not appear as a top cause of death, but many heart attacks, strokes, and kidney failures, in fact, trace back to diabetes. And diabetes also complicates the treatment of many other diseases, including COVID-19. I'll talk a little bit more about that later. But as you can see, the government, the leadership in the whole of government, the whole of Singapore was and has been, and it will continue to be involved in the fight against diabetes, just as much as we are in a fight against COVID-19. So PM Lee said that he believed that prevention was better than cure. So there was this whole raft of things that the government was doing. For example, the government was strongly encouraging Singaporeans to adopt healthy lifestyles, mandating the grading and labeling of drinks, soft drinks, so that you can see how much of sugar there is. And then he wanted to ban the advertising of beverages with high sugar and saturated fat content. The government was promoting regular physical activity. And in doing so, you built parks and fitness corners, made it easier for cyclists and joggers and exercise groups to get to do their thing. He started a national health screening program. We've had health screening programs for 20, 30 years, but to sort of put things together, make things easier for Singaporeans so that whoever would get diabetes would pick it up early and start treatment early. And then for those living with diabetes, he wanted to strive to optimize disease management, emphasizing the prevention of complications. He set up the diabetes centers to bring the professionals together to raise standards of care, education, and research. So a whole bunch of things that the government was doing, right? And a whole bunch of things to help Singaporeans do things better. So firstly, Health Promotion Board, Ministry of Education was going to start them young, along with the Early Childhood Agency, Development Agency. So what you're going to do, you make sure that the preschool, the kindergartens actually have healthy meals. Then you make sure the primary schools and secondary schools have healthy meals because you control what the school canteens are able to sell. And then actually, it's not in this slide, but he also arranged for the universities and the polytechnics to actually have canteens and vendors on board with the healthy meals. And the Health Promotion Board also increased availability of physical activities for working adults and seniors, such as Sundays in the park, sunrise in the city, and of course, the National Steps Challenge. And I think this National Steps Challenge has really become something quite popular. Then in order to help you to make better choices, they had healthier choice symbol products across a whole bunch of consumer food categories, healthier dining program to make sure that the hawkers actually give you better choices so that you can choose the healthier option. Don't put so much of pork lard on your dishes, for example. And more food manufacturers developing healthier ingredients. And for them, actually, lower sugar also means lower cost, but also healthier for the consumer. So it's a win-win situation, right? Then Ministry of Health was also saying, okay, we'll make it cheaper for you to go and do screen for life. Make sure that not only are you screening for diabetes, but you're actually screening for heart disease and cancer, because people with diabetes are more likely to get heart disease and cancer as well. Then for the younger people who didn't think that they would have diabetes, there's this diabetes risk assessment tool so that you can actually say, hey, I'm not 40, 50 years old yet. I'm actually younger, but am I at risk? So if you go through this downloaded assessment tool, you can tell. And then many of the women who are in their 20s and 30s, but who are pregnant, actually 1 in 5 will have gestational diabetes or diabetes in pregnancy. And of these women with diabetes in pregnancy, 40% of them will later on go on to develop diabetes, type 2 diabetes. So it's important that you catch them early and screen them before pregnancy, during pregnancy, and after pregnancy. And during pregnancy is also important because if a woman has got gestational diabetes or pregnancy diabetes and is not well controlled, then the child who comes out will have a much higher risk of having diabetes in the next generation and a much higher risk of obesity in that next generation as well. Okay, so that's actually quite important. Then from May 2019 onwards, MOH also made it easier for people to have screening tests for diabetes because they introduced a non-fasting test saying that you don't actually need to fast in order to take your blood so that more people have opportunities to test themselves for cholesterol and diabetes and less have an excuse not to do so, or I forgot I had breakfast already. Okay, and then for those people who actually have diabetes already, there was actually enhancement of the chronic disease management program to make it easier, to make it cheaper, increasing it safe withdrawal limits, giving reference materials so that people can download and read for themselves. Their doctors and their caregivers can also get more up-to-date knowledge. We have patient empowerment for self-care, and the support group of Diabetes Singapore is an example of that, where through better knowledge, you're actually better able to care for yourself. But actually, it's not just the patients who need to know more. The primary care networks were networks of polyclinics and GP clinics that band together so that they can actually do things with higher standards, more commonality, and deliver a product in terms of diabetes care that is scalable, reproducible, and actually very good. Okay, and it's team-based so that actually everybody works together and is on the same page. Then again, just to make sure that it's not because of not having enough financial resources that you don't turn up to get good care. The Community Health Assist Scheme, or CHAS, gives subsidies for the treatment of chronic diseases, including diabetes, from about 2 years ago. So we've got this whole bunch of things, whole lot of policies in place, right? And now you've got better facilities in place as well. So for example, you don't have to go and see an eye surgeon or the eye center for screening of your eyes anymore. You can actually do it at polyclinics. And for many years, Diabetes Singapore, the Diabetic Society of Singapore, used to run a van system so that we would bring the eye cameras to various places so that people could get their eye screening. But now we've got an integrated diabetic retinopathy program, and we're trying to use artificial intelligence, or AI, to make things more efficient so that it's cheap and easy to go and get your eye screened. And I believe that, in fact, some of the private sector players are also getting into the act to make sure that maybe they have a non-dilated fundal camera system, fundal photography system, so that even if you're not under the polyclinics for care, you can still get eye screening for maculopathy, for diabetes eye disease. The other thing also is that the kidney disease people realize, look, you don't want to wait for people to turn up at your kidney dialysis center at an end-stage renal failure. We should actually get people early on at the beginning of diabetes or the middle of diabetes, when the kidneys are starting to fail, hopefully not failed yet, and try and get them to be screened and to be treated, and for preventive treatment to be made easily available. So we are doing this at polyclinics. And similarly, preventing leg and foot amputation is not about trying to save the leg that has already turned color, that is already starting to rot. What you want to do is have good diabetes control. You want to have good foot care so that diabetic foot ulcers don't start in the first place. And if they have started, that you care for it and make sure that it doesn't get worse, so that we reduce lower limb amputation. If you're amputated, you can't really exercise. You can't really exercise, your diabetes control gets worse, right? So you have to stop all of these things at the beginning. Sorry. Now, but at the end of the day, the doctors and nurses can't do the job alone. Government can't do the job alone. We've got all these programs, all these wonderful things, but it's not about doctor does this, government does that, and we as the consumer, we as the patients, we as the general public just sit there and consume. So Professor Philip Chu, who was a group CEO of National Healthcare Group, quite recently said, and I think this is a very nice quote, we need to move away from transactional medicine, where patients are told what to do, right? We need to encourage patients to take greater ownership of their health and promote behavioral changes and better lifestyle habits, as well as the early detection of diseases through appropriate screening and case finding, right? So you go look for something. As actually one of my Indonesian patients said to me some time back, he said, at one stage, before people realized how important immunization was for COVID, the vaccine was looking for suitable targets. And later on in our neighboring country, the people started looking for the vaccine because they started to realize how important the vaccine was to preserve their health. So we, in the area of the war of diabetes, need to make sure that we change the paradigm. So it's the patients, it's the public who want to look for better healthcare, take greater ownership of their own health and their own lifestyle habits, so that they can pursue the target of not getting diabetes in the first place, be the 2/3 who doesn't get diabetes in their lifetimes, rather than being the third who does get diabetes in the lifetime. If you're in the third who has gotten diabetes or who's going to get diabetes, make sure you're in the group that have got good control and not the group that have poor control. So To summarize it, you can say, to help fight the war on diabetes, firstly, you want to prevent type 2 diabetes by maintaining a healthy body weight and observing healthy diet and exercise. And actually, it's not that difficult because we find that modest weight loss in overweight people with diabetes can already improve blood glucose control and lower the risk of heart disease and stroke. So this is in people with proven diabetes, okay? So if you're already overweight and you already have diabetes, you lose weight, you can improve blood glucose control, improve blood pressure, lower the risk of heart disease and stroke, okay? If you do at least 20 to 30 minutes a day of exercise, that would be very helpful as well. If you say that you don't have time to exercise, well, you can. I work 12-hour days. I sometimes have to do my exercise after work. This morning before doing this lecture with you all today, I've already done my 5 kilometers. Right. The other thing that we want our people to do is that there's no point if the government gives screening programs and people don't want to show up. And if you get screened and then you forget what the results are. Can you imagine you buy Toto and then you forget to check that and you didn't really know that you had a winning ticket? That's silly, right? But it's the same way that if we go for screening programs or free screening this, free screening that, and then you don't find out what the result was, or you found out that, oh, actually the result says that you are at risk, and then you don't follow up, then check for what? Screen for what? So we want to have eligible Singaporeans to go for the recommended cardiovascular risk, colorectal and cervical cancer screening and follow-up at CHES GP clinics, right? Make it simple, make it cheap for you to do so, and then please follow up. So the government has been successful. They've increased the follow-up rate from about half to 85%. It's about the same percentage that have up to now gotten their COVID vaccinations. The last 15%, not so easy. Okay, but going to following up an abnormal result means that you get treatment early. Getting treatment early means getting more effective, cheaper treatment, and better health. Now, yes, diabetes can be very complicated. This is actually the comprehensive medical evaluation and assessment of comorbidities for the standards of medical care in diabetes by the American Diabetes Association in 2021, right? Long list down here. It's like servicing your car, you need to have about 160 different items to be checked, right? So it looks very complicated, but don't get discouraged. We can win this war together. The first thing is to show up at your screening center to get screened. If you've got a positive result, go see your doctor. If your doctor says you need to go for further screening, further tests, please follow instructions. If you need to be followed up at a specialist clinic, please follow instructions. And then you will find that actually most things will be checked as okay, 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 rather than checked as not okay, not okay, not okay, needs an amputation. Okay, now in any war, correct information is vital, right? If you don't know where the enemy is, how are you going to attack the enemy? And COVID-19 epidemic has taught us that ignorance kills, because if you're ignorant, if you think that vaccines are bad for you rather than good for you, you wouldn't go for the vaccination and you have a higher chance of dying. So correct knowledge helps people to make the right choices and do the right thing to help themselves. So the war against misinformation is crucial. We need to know who is more at risk of type 2 diabetes, because if you know who is at risk, then you can say, if this is your loved one, hey, go and get screened. If this is yourself, what are you waiting for, right? So who's more at risk? The obese and overweight, the inactive, the smokers, the ones with a family history of type 2 diabetes, the ones who have hypertension or high cholesterol, those who have a family history of type 2 diabetes, those who are born small for gestational age. That means your birth weight is a bit low for the number of weeks of gestation. So babies are born at 37 weeks, 38 weeks, 40 weeks, 41 weeks. You might be small for gestation if you are, say, 3 kilos, but you were born at 40, 41 weeks, but 3 kilos and you were born at 38, 37 weeks, it's not bad for weight, right? And those whose mothers had gestational diabetes or diabetes during pregnancy, you're at greater risk, especially if you're a fat kid, right? Now, people also say, hey, cannot lah, you know, this diabetes is actually something in the elderly, right? Because there's 1 in 3 in the elderly, and I'm at a young age, it's only 1 in 100. Well, yes, diabetes, type 2 diabetes is usually seen in older adults, but the youngest patients with type 2 diabetes can be below 10 years of age. And I said in the USA, because in the USA, they find 8, 9-year-olds with type 2 diabetes. But Singapore, from 14, 15 years, no, not 14, 15 years, from the early 90s, from 30 years ago, when I first started doing diabetes, I remember actually seeing young people. My first patient with type 2 diabetes in childhood was the 14-year-old girl, right? It can happen. If your mom had diabetes, if you're a little bit overweight, you've got a strong family history, 10, 11, 12, 13, 14, you can get type 2 diabetes. In fact, KK Hospital sees about 25 new type 2 diabetes patients in their teens each year. That's not counting NUH, that's not counting the private sector. Obese children can have pre-diabetes if they have other risk factors, like a family history of type 2 diabetes, mother had gestational diabetes, and if they themselves were either overweight or not exercising enough. So people have this idea that you need to be very big size before you get diabetes, but the average person with diabetes in Singapore has a BMI of about 25, not 30, not 37, 25. That's not very, very heavy. The other thing is that you can actually look for the physical signs. So you can see this. This is called acanthosis nigricans. And I've chosen some rather obvious pictures, but some people have milder forms. This pigmentation is not because the guy concerned or the woman concerned didn't bathe and didn't clean properly. This is because there's increased pigmentation due to higher levels of insulin, right? And these higher levels of insulin actually are presaging the at-risk features. These people with this kind of pigmentation are more likely to get diabetes. In fact, by the time they have this kind of pigmentation, very often they have pre-diabetes. And sometimes these pigmentations can start going away. It can go away for 2 reasons. One, if you become healthier, it goes away because you become less insulin resistant. On the other hand, if your lifestyle is still terrible and it starts to go away, it's because your body is no longer able to make insulin. And when the insulin levels fall, then the pigmentation goes away, but the diabetes comes. Okay, so if you see someone like this, say, please go and get yourself tested. If your sugar level is still good for you, but start exercising, because it is a sign that your pancreas is overworking. So when is the best time to screen for diabetes? You screen for diabetes once you know that you are at risk. Don't wait, because I said you can get diabetes now in your preteens, your teens, and your NS age group, and your young working adult life. Early detection means that the use of simpler, cheaper treatments, which can be more effective than treating diabetes with expensive medications in later stages. Okay, it's not necessary to have a fasting blood test for diabetes. Actually, the time when the blood glucose is likely to be highest is after the meal. Fasting blood glucose tests can miss 30% or more of people who actually have diabetes and abnormal glucose levels. This was actually discovered about 20 years ago by some of the researchers in Singapore, right? 30% will be missed if you have a fasting blood test, because the time when your blood glucose is most abnormal is after a heavy meal, right? Because then the pancreas can't cope and the sugar levels go up. So if the purpose is for you to find out early, then you must actually pick the time when your blood sugar is going to be most abnormal. It's actually after a meal. Now, weight loss improves more than just body weight. Weight loss reduces the risk of type 2 diabetes, reduces mortality in heart disease, improves cholesterol, improves blood pressure, improves severity of obstructive sleep apnea. And these are all things, all the risk factors of heart attacks and stroke, which is also not fun, right? So weight loss is actually very important. In fact, actually the benefits of weight loss get higher as you go along. It starts around about 3 to 5%. Diabetes risk comes down just with 2-3%. Now 2-3% is 1-2 kilos, you know, not 5-10 kilos, just 1-2 kilos actually for average person actually starts to make a difference. But of course, the more you lose, the more you save. Okay, the more weight you lose, the more benefits you gain. Look at that. Okay, so the more weight you lose, the more benefits you gain internally. It's not just your clothes size getting better. There are a lot of things that actually will get better as you lose more and more weight. 5%, 11%, 16%. All right. Now, people will also say, hey, very difficult. I know what you mean. I jog 15, 20 kilometers a week, but I have difficulty keeping my weight low. I just try and say, I want to maintain it. I try and maintain a healthy lifestyle. But weight loss is a difficulty for a lot of people. Well, I've got good news for you. Modern diabetes medications can help people to lose weight. There are two types of diabetes drugs that can not only improve blood sugar, but can also lead to weight loss. And you must ask your doctor about these medications because you might be one of those that can benefit. The first group are called the GLP-1 agonist group or the glucagon-like peptide group. So many of them are weekly injections, or in fact, they're twice daily injections like exenatide. But recently, there have been two new drugs called Ozempic and Rybelsus, which are semaglutide. And this is a class of drugs that previously used to have to be given by daily or weekly injections, but most recently they've got a new one that can be given as a once-a-day oral tablet. So why is this important? Because the GLP-1 medications are such that using GLP-1 medications alone, you can lose 1.5 to 2.5 kilograms. And remember, we said that at 1.5 to 2.5 kilograms, you already start to see important improvements like a lowering of diabetes risk. But if you do serious lifestyle changes and add a GLP-1 agonist, you can get 2.8 to 6.5 kilograms of weight loss. That's about 10, 15 pounds worth of weight loss. And that 10, 15 pounds worth of weight loss, you seriously start to get a lot of improvements in other things, including cholesterol, blood pressure, fatty liver, and actually cancer risk as well. Now, the other group, which is in fact in common use in polyclinics, is the SGLT2 inhibitors. And they make you pee out your extra glucose in the urine. And this loss of calories also leads to weight loss as well as better diabetes control. So it includes things like Farxiga or Invokana and Jardiance. And many of you are actually getting some of these medications from your GPs. They're not necessarily cheap dollar-wise, but if you look at it in terms of what it can do for your health, this is really a group of drugs that are game changers, right? So you can take a picture of these slides and then go and talk to your doctor about it. So, but what if I've got type 1 diabetes? Well, yes, some people with type 1 diabetes will benefit from insulin sensitizers because they help reduce insulin requirements and improve blood glucose levels. Metformin, cheap and good, is the most commonly used insulin sensitizers, but other medications include SGLT2 inhibitors, GLP-1 agonists, and DPP-4 inhibitors, some of which you saw on the previous page. One of the latest things that has just come out, and you notice the date of publication is today, November 13th, 2021. And this has just come out in the Lancet, a British journal. Out of data from 200,000 people from about 20 controlled trials, they found that a drop of 5 mm mercury in systolic blood pressure can reduce the risk of diabetes by 11%, right? So now you can use blood pressure medications called ACE inhibitors and ARB blockers or angiotensin receptor blockers to protect you against diabetes, okay? But some blood pressure medications like beta blockers and thiazide diuretics can actually increase the risk of diabetes. So we are now asking doctors to be careful about which blood pressure medicines to use for people with high blood pressure. You want to use the one that reduces the risk of diabetes and not increase the risk of diabetes. Now, I also want to talk about 5 other common myths and misconceptions that lead to poorer diabetes care. One is that insulin can be omitted during disease because of poor appetite. That's wrong. That can cause life-killing, fatal diabetic ketoacidosis. The second thing is that insulin dose is the same every day once you have figured out the correct dose. That is wrong. Life is not the same every day. People with diabetes cannot exercise vigorously. That is wrong. Diabetics in Singapore don't have to worry about celiac disease because it is rare in Asians. That is wrong, 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 wrong. And elderly people with diabetes and comorbidities should not get a COVID vaccine because you already have comorbidity. Wrong lah. You need the vaccine. So firstly, never stop insulin completely in type 1 diabetes because insulin for these people is like oxygen. You don't stop breathing because you're sleeping, right? You need insulin all the time. In fact, when you're sick, your insulin dose needs to be increased, especially when you're having a fever, even when you're not eating, because there's increased insulin resistance. And if you're on a pump, your doctor will be going through a protocol with you, what to do, what if, in case your pump is the one that's a problem, in case it's your injection site that's a problem, in case it was your insulin that was a problem. Okay, I'm helping to write some international guidelines on this, but you can look it up under ISPAD or ISPAD. The next thing is to say, what are the strategies to reduce glucose variability? Sounds simple, right? Well, better, more predictable insulins, better understanding of the patient's specific situation, better monitoring, better dose titration. Dose titration means that you must accept that you can't be using the same dose every day in the same way, that you're not going to eat the same food with the same dishes every day. Okay, so one of the things that really was a game changer was this thing called the Libre, or the flash glucose monitoring, right? And it allowed a lot of people to have continuous glucose monitoring at a relatively low price. And it's a graphical interface. You can actually see how much of green you have. That means how often you're in target range, which time of the day that your sugar levels are actually highest. For example, I would like to worry about my dose here. I want to worry about hypoglycemia in the night. And if I want to calm down, I'm able to say, oh, actually, it's this time of the day, usually this meal. Maybe I'm actually having some event like a tuition in the afternoon on Wednesday, right? That's the time when my sugar will go high. Or I have a sports event on Saturdays or Thursdays. That's when my sugar goes low. And that's using a continuous glucose monitoring. But you can use the same principle with finger pricks, except that the data is less granular. All right. So you actually have different targets, whether you're older, whether you have gestational diabetes, whether you have type 1, because you have to see the trade-off is between the risk of hypoglycemia versus the risk of hyperglycemia. Okay, but no point having targets unless you are able to do something about the targets. So for example, using this continuous glucose monitoring, this person can say that at this time of the day, I'm usually running very high. So maybe this is the time when I need to increase my dose. This is the time when I need to be decreasing my dose. This is the time when I this and that, the other. Okay, working out how the insulin doses, when to give more, when to give less. This is how you can have a graphical interface. And it helps you to make better use of the data. Because previously we'll just say, oh, my blood sugar level is always about 5, 6, 7. And you think you're doing well, but you never knew about the time when your sugar was very low. And when your sugar is very low, you're also at greater risk of a heart attack and stroke. Yes? Okay, so we need to know how much a person typically requires. Typically, a total daily insulin dose for a healthy person is about 0.7 units per kilogram per day, right? And if you know how many units per kilogram per day, you can also work out 1 unit will usually bring down my sugar by how much. 1 unit can usually take care of how much of carbohydrate. the important thing about this is that if suddenly you find that your requirement is very high, hey, maybe there's something else going on, maybe gluten intolerance, or maybe I'm having a sickness that I did not know about that's causing me to have higher insulin levels. Maybe I have type 2 diabetes genes, even though I have type 1 diabetes, and I need to use an insulin sensitizer. Okay, so the other thing I always tell my young patients, and for that matter, the older ones, is that your timetable matters. What you do in that timetable matters. Say, for example, Monday soccer practice, you're at risk of hypo, right? Wednesday maths tuition, you're at risk of having high sugars because many people find maths tuition very taxing, or maybe Chinese class, right? And on a Sunday when you wake up late, have your big family meal, would you need the same insulin every day? Of course not. You have to change. Some days will need more insulin. The days when you're very active, your body is very sensitive to insulin, you better reduce the insulin. Otherwise, you will get hypoglycemia, right? And your doctor is supposed to work out with you whether it's actually an every Monday thing or actually only when you do certain things. Oh, when I do a 10-kilometer run, I need to do something about the dose. Okay, well, this is also because we always think in terms of hypoglycemia or low blood sugars with exercise, but that's not always true. Certain types of activities like sprinting, weightlifting, they can actually bring your blood sugar level up. Exciting games will bring your blood sugar level up. Computer games can bring your blood sugar level up. Whereas aerobic exercise, continuous exercise can bring your blood glucose levels down. Okay, so exercise has to be accounted for at all times. Intense bursts of activity tend to raise glucose levels, but prolonged aerobic activity tends to lower glucose levels. And a doctor can work out with you, or what type of exercise, how many grams of carbohydrate per day. It's just like working out how many liters of petrol you need to use if you're traveling from here to Penang, right? There are also different strategies. So for example, Riddle is one of the authors who has written a lot about how to help people who have active lifestyles plan their blood sugar levels. So you don't have the same targets. So some people actually, before a long bike ride, would have a slightly higher glucose level, so that at the end of the long exercise, they are just right and not having hypoglycemia. This is beyond the scope of this talk, but another exercise and diabetes talk, maybe you can talk more about it. And it's the same principle for type 1 diabetes and type 2 diabetes. Okay, so the other thing is that sometimes insulin requirements change because of stress, right? Some people are just more the worry, kanchong spider type. Some are very chill. Some need insulin more than usual just to get through exam periods, menstrual pain, steroids. And also one of the things that is more recently found out is that meal types, for example, high fat and high protein meals need more insulin. In other words, we used to only count carbohydrates, but actually for the people who want a very good control, you need to actually count fat and protein as well. But again, the details are beyond this talk. The other thing is that celiac disease and gluten intolerance can also make sugars go up. So I want to spend a bit of time on this. Celiac disease is seen in 1 to 2% of Caucasians and 6 to 8% of people with type 1 diabetes. These are Caucasian figures. It's also seen in 1 in 10 of children with growth disorders. So I see quite a number of these guys, right? And it's more common in those people with thyroid. And why is that important? Because thyroid is more common in people with type 1 diabetes too. Now, what's celiac disease? It's systemic, it's autoimmune. It's when you are intolerant and allergic to gluten, which is a protein in wheat, barley, and rye. It can present as post-meal hypoglycemia, that means low sugar, or post-meal hyperglycemia. It can present as your blood sugar going high for no apparent reason and staying high the whole day. The family members or the patient himself can have bloating, recurrent abdominal pain, diarrhea or constipation, sometimes more prone to rashes, headache, foggy mind, depression, anxiety, lethargy, numbness and pains in fingers, joint and muscle pain, a lot of the hong-sip type things. Okay, so in the people with diabetes, it can present with hyperglycemia or hypoglycemia, right? Now, what's gluten? Gluten is actually a protein found in wheat, in foods made from wheat, rye, and barley. So it's bread and pizza, pasta, cakes and biscuits, Korean, Japanese noodles, Chinese noodles, soy sauce, Milo, Horlicks, Ovaltine, beer, ice cream, ketchup, some cosmetics and hair products and shampoos. Why is this important? It can happen at any time. You're not necessarily born with it. You could have been fine in childhood. You could be even fine until you're elderly, and then you can get it. At any time you can get it. It is more common in people with diabetes. It's more common in the relatives of people with type 1 diabetes. And for all those people, last week I was listening to another seminar by another organization, and someone asked the speaker, oh, do we need to worry about gluten intolerance in diabetics in Singapore? And the speaker said, no, this doesn't happen in Asians. I'm sorry, that's wrong. Recently, there were 7 Indian studies involving 915 type 1 diabetes children in India. 13.8% of them had celiac disease, but only 3% of them was severe enough to have a biopsy positive. The rest actually had different ways of presentation. Okay, it is true. This actually, this paper, this diagram comes from a paper with one of my teachers and one of my classmates, Professor Kang Jin Yong and Dr. Gwee Kok An. And a few years ago, we used to think, oh, the green part, that's the whole of Asia Pacific. We don't get celiac disease. Wrong. The blood test studies shown that actually Southeast Asia is not low, a pooled prevalence of biopsy-proven CD, we are not that low. Asia is not that low compared to Europe. It's about the same level as Europe, about 0.8%. In fact, this paper is from India, from Makaria's group, All India Institute, or medical. And it shows that India, and you see Malaysia, Singapore down there, is in very dark colors. The darker the color, the more celiac disease. Notice Malaysia, Singapore, India is a darker color than North America. It's actually a darker color than Western Europe. There's a recent study from Malaysia. It showed that the Chinese have 1.7% prevalence in a university setting. Okay? But most of these patients were positive, didn't even know they had celiac disease. There's another study in China in 2017 that they showed that 2%, 2 out of every 100 university students in Jiangxi actually had celiac disease blood test positive. It's not a small study. They actually took blood from 20,000 people to give you these results. The Malaysian study took blood from 600 people to give you these results. My own studies, I did studies on my patients, and I have a very international clinic. On this part, the Caucasians are about 1/3 and the Asians are about 2/3. But when I tested for celiac disease, there's 1/4 of the Caucasians who are blood test positive for markers of celiac disease. That's 1/4 of the Caucasians, but 1/3 of the Singaporeans, 1/3 of the Asians. So in fact, actually, seropositivity for Asians is not any less than the Europeans. It may be more, right? 84 patients, we did all our bloods at Tan Tock Seng Hospital there. Any marker positive, Asians 40%, Caucasians 20%. TTG IgA positive, which is the marker that the Caucasians use, yes, Asians only 17%, Caucasians 20%. Hey, but 17 and 20% not so different. In fact, if you use any marker except TTG IgA, the Asians come up more. Okay, so it is wrong to say that Asians are less at risk of celiac disease than Caucasians. This is data. This is not opinion. Why must this be so? Well, there's another paper that came out from the US just last year, and it showed that one of the reasons why people are more likely to get celiac disease nowadays, irrespective of what they eat, is because there are pollutants, industrial pollutants, and chemicals in the environment that increase our risk. DDE is one of the breakdown products of DDT, which is an insecticide that we have been using for many years. And BDE 153 is one of those industrial chemicals. So whether you're a boy or girl, industrial chemicals, environmental chemicals, that has increased our risk. Okay, how does this affect us? Well, celiac disease can present early with glucose variability and poor growth. So this is one of my patients. This is one of the a little girl who, when she has type 1 diabetes, when she eats out and she has gluten, her sugar levels will be very high, and she will need about 2 to 3 times the normal amount of insulin compared to other times when she is not eating gluten. Right now, I actually have a patient with newly diagnosed diabetes in one of the hospitals. And although the gluten tests have not come out, we are seeing that when this young man eats food with gluten, his sugar is very high compared to other foods. So this is one of those things. And this particular girl had very high numbers. You can see the TTG IgA is high, and she's a Chinese Singaporean girl. This is a French boy from Jakarta. He came to see me and asked for a second opinion. And he had half of the doses required. That means we could reduce his dose of insulin by half when we took away his gluten from the diet. And this is another boy from Indonesia. This one is an Indonesian boy. And when we took away gluten from his diet, although he presented with diabetic ketoacidosis and combined with type 2 diabetes, right now, he's actually most of the time on metformin. And sometimes when he's sick, he needs to go back on insulin. Okay, so I've shown you 3 patients. They're just my ordinary patients from my clinic. Now, just to finish up, I say that diabetes has been different during the COVID period. Even though we are having a hard time trying to see the doctors in person, the good people at Tan Tock Seng actually found a way to do virtual healthcare delivery by phoning people up and saying, hey, how are you doing? What are the foods that bring your glucose levels up? What are the foods that bring your glucose levels down? Are you using the right dose? This and that. A lot of things can be done over the net, over the smartphones. It's actually whether the patient wants to work with the team, because, you know, there's a Chinese saying, 你不可以把牛拉上树, right? You can't make a cow climb a tree. The Western people says you can bring a horse to the river, but you cannot force the horse to drink the water. So we as patients and we as the healthcare providers must want to work together. Then whether you are using a smartphone, you're using internet or using fax machine, all sorts of things, you can do it. In Africa, they actually use SMS because that's all they can afford for some of these more remote people. Okay, so I just want to finish up and say that the people with COVID-19, if you have diabetes, you are much, much more likely to get into ICU. You're much, much more likely to die if you have diabetes and you get COVID. So actually, those with the morbidities like heart disease, high blood pressure, diabetes, you should be the ones to get vaccination. Okay, there was a meta-analysis of 33 studies from US, from China, from France, and they said that the prevalence of diabetes, the prevalence of COVID is the same in the diabetic patients as in the general population. So in other words, you're not more likely to get COVID if you have diabetes. But if you have diabetes and you get COVID, you are much more likely to die or to end up in ICU. Okay? Diabetes is an important risk factor in severe COVID because of older age, pro-inflammatory, and hypercoagulable state. That means you're more likely to get stroke. You have underlying morbidities like hypertension, heart disease, chronic disease, obesity. So this can actually cause the complications of COVID, and that complications leads to early death. Okay, the Ministry of Health in Singapore says it's safe for type 1 and type 2 diabetes people to have COVID-19 vaccine. I've quoted the Moderna study. The Pfizer people have done the same, right? All the other manufacturers have also done the same. They do include people with diabetes in their studies. And actually the risk of getting a bad outcome from COVID far outweighs any potential side effects of the vaccines. Okay, the COVID-19 mortality rate is 7 times higher for diabetic patients and 6 times higher for those people with hypertension. And also because diabetes patients tend to be more susceptible to pneumonia that also gives you a higher risk of death. So finally, you look at this, the vaccinated people, irrespective of whether you have diabetes or not, are much less likely to end up in ICU or end up with death than the people without vaccination. So please, especially if you're elderly, you have comorbidity, you are at risk of diabetes or you have diabetes, please go and get yourself vaccinated because you are much more likely to be protected. Please help yourself, help other people. COVID-19 vaccine is not the only vaccine that people with diabetes should have. There's a recommendation for influenza vaccines as well. There's a recommendation for pneumonia vaccines as well. You should go ask your doctor about these things. Okay, so I don't want to take any more of your time. Thank you for your attention. Let's win the war against diabetes together. Thank you very much.
Thank you, Dr. Warren Lee, for your very insightful and informative sharing, as well as very useful tips. Yeah, let's put our hands together. Thank you, Dr. Warren Lee. Thank you very much. Okay, well, our next speaker, next two speakers are Miss Juliana Lee and Mr. Kenji. Right, let me bring them on. Okay. Before I invite the two speakers to come on board, right? The topics that they are going to cover, okay, are their personal experience sharing, from their own personal experience as well as from their people around them, their family, okay, and also they are very active volunteers at the Diabetic Support Group of Singapore, okay? Yeah, correct. Yeah. Okay. Miss Juliana Lee, she's an IT and admin executive, a type 2 diabetic that runs in her family. But she believed that through healthy diet and balanced lifestyle and regular exercise, she has been able to put her condition under very good control in the past years. So that's why she's very passionate to help create diabetes awareness among people. And also she has been leading the Diabetic Support Group since May 2010. She's the organizer of walking activities for DSG, the Diabetic Support Group, and also at present, she's the chairperson for DSG of Diabetic Singapore. I was together co-sharing with Miss Juliana Lee is Mr. Kenji. Mr. Kenji is Japanese as well as French. Yeah, he's a technology enthusiast with a passion for anything that is digital. He helps companies and individuals setting up, innovative mindset, creating innovative mindset, and adopt technology changes to bring upon positive change. Yeah. He is a type 1 diabetic, and also his family as well. They have been through this for many years. Mr. Kenji is very passionate in becoming a volunteer at the Diabetic Singapore Support Group. Okay, and he's also very passionate to help patients improve and manage their conditions through some gadgets and also some apps, online apps to help better control, better monitor their conditions. Okay, so without further ado, I would like to bring the two speakers on board, invite them to start their sharing. So I pass over to Ms. Juliana and Mr. Kenji. Thank you very much.
So I hope everyone can see. Juliana,
yes,
please take it on.
okay. We can start now.
Yep.
Yes. Thank you.
Hi, good afternoon. My name is Juliana Lim. I'm actually the leader of Diabetes Support Group for Diabetes Singapore. Next slide. Diabetes Singapore, we have actually a diabetes support group. So it is part of Diabetes Singapore, which provides a platform for people with diabetes and their family members to share their experiences in dealing with diabetes, and for those who are newly diagnosed, opportunities to interact and learn from other members. We also formed multiple interest groups to bring together members with similar interests, such as cycling, painting regularly. In my years of leading the diabetes support group, my forte is actually in the organizing of walks, which is normally on the last Saturday of every month since May 2010. I first joined Diabetes Singapore as a member. At that time, it's known as Diabetic Society of Singapore back in 2000. So when I lead the Diabetes Support Group, known as DSG for short, that was actually in May 2010. I am actually very passionate about helping my peers live a healthier life with diabetes. So this is actually what prompted me to take on this mission and strive for these skills. Before the COVID-19 pandemic, I have been organizing walks on the last Saturday of each month for DSG with a team of dedicated assistant leaders. Most were diabetic peers and volunteers. Next, please. Next. As part of Diabetes Singapore, DSG activity supports many of the events organized by DS, short form for Diabetes Singapore. Okay, for me, I live as a type 2 diabetic for over 34 years. So I manage my condition through a rigorous diet, which involves portion control, that's key, strict medication adherence, regular exercise, such as walking, and communication to maintain a mental well-being. I am really thankful to Diabetes Singapore for the education I received. In my journey living with diabetes, I got to better understand my body. That's not easy, but during this journey, I actually gained awareness of the long-term side effects and learned to take the necessary actions and make some lifestyle adjustment to keep them at bay. Next. I would like to show you an outing video by the Diabetes Support Group, DSG. It's a 4-minute video. This is actually one of the walks that I organized in 2017. I normally plan my walks for the whole calendar year each year and submit this to Diabetes Singapore. So for all the walks, the start meeting point is normally in the MRT beside the passenger service, and we actually started things like 3:30 p.m. on the last Saturday and ends about 6 p.m., 6:30. So after that, we actually go for dinner on that at a nearby hawker center or food center. During the walk, we started off with orientation. I will actually orientate some rules, and all members who are actually DSG members, we bring our own glucometer to do a pre-blood glucose test. Okay, that is recorded, and at the end of the walk, a post-blood glucose test. So all these readings are with a purpose to actually ensure that we are all fit to go for the walk. And these are actually submitted to Diabetes Singapore for records because we are part of Diabetes Singapore. DSG is part of Diabetes Singapore. So for the safety of every walker, okay, we have to be in proper walking shoes. And if members are found to be under hypoglycemia, we will keep on the lookout. We cannot continue the walk. They will have to actually take sugar to raise up their blood glucose enough for them to actually go for the walk. So, and people who are on hyperglycemia, that means more than 12 millimole, we are 13, 14 millimole, it is considered hyperglycemia. We can't actually deny them from joining us in the walk, but we are watching out for them. You know, you have to hydrate yourself with water, and if they are keen to join us, we have to watch very closely. But we will normally people who are hypoglycemia or hyperglycemia, we will normally discourage them from joining us in the walk. This is actually the safety of the walkers. If some members are actually forget to bring the glucometers, it's okay. Diabetes Singapore do sponsor us with some test strips and glucometers, and my team, we actually help to actually to take the blood glucose for to all the members without the glucometer. But for me myself, I always have my glucometer with me, and I initiate by taking the pre and the post. During the walk, there are actually, I normally arrange for a certain meeting point, okay, where we will have an interaction among the walkers, or an exercise which I will initiate, do some form of stretching exercise, and there are photos being taken as a group and individuals throughout the walk. So what you see here in the outing video shows the bonding among all our members. So there is this bonding and this sharing among each other, and how individually we manage our condition. I think we have reached the end. Next, I will hand over to Kenji.
Thank you, Juliana. I hope this video, gave us gave you all a foretaste of what our diabetic support group gatherings are like. We of course invite you. I mean, if you haven't joined our group activities, at the end of the session, Juliana will explain, how you can reach us, and how you can take part in our activities. Now, coming to my sharing, and just before I proceed with sharing with you some of my experience during the pandemic period as a diabetic, I just wanted to introduce myself a bit, and as Josephine mentioned earlier, I'm French Japanese. I'm passionate about technology. I'm 45-year-old. I've been living with diabetes for actually over 12 years now. I'm a type 1. I've been a type 1 diabetic for more than 12 years. But I've got to know diabetes also, through the experience of my mom, who has been a type 2 diabetic for many years. My grandfather, who has been a diabetic as well, and I also have, on my father's side, a cousin who's a type 1 as well. So diabetes has been quite prevalent in my family, indeed. And I've been volunteering at Diabetes Singapore for a number of years, I think since 2013, and joining some of our activities, and also sharing my experience as a diabetic. So the first thing I wanted to share, and in terms of what the pandemic has brought, and what steps and actions I've taken during this pandemic period. Thinking of what I've tried to do differently, I think probably a lot of you have experienced doing much more of these Zoom calls, and spending much more time on your computers and devices, which is not necessarily a great thing from a diabetic experience standpoint, because I also came to notice the side effects of that on my conditions. But among the positives, I also got to discover that there is actually an abundance of resources available online, and that have allowed me to self-educate, to get more educated, on a lot of different topics, including on diabetes. And this is consistent also with how we at Diabetes Singapore have undertaken to move a lot of that knowledge, online, as previously a lot of these sharings that we used to organize used to take place in the form of physical events. But over the past year and a half, we have undertaken to make a lot of these events, gatherings, talks, discussions available online, and these are just a few examples of some of these recent activities that we have made online. And I invite you all to check the Facebook page of Diabetes Singapore, as all of these contents will be posted for you to enjoy and take advantage of. Okay. So education, continuous education was definitely an important aspect of this pandemic. My second experience is about how I managed to leverage technology and tools that are available nowadays to better manage my condition. And early on, Dr. Lee, I think, was mentioned about these new flash glucose monitoring devices, which I mean, to me, have had like a profound impact and have enhanced really the way I keep track of my blood sugar. And I just want to also bring to your attention that it's not just about the medical devices. There is also an abundance of consumer technologies, be it fitness tracking devices today, or applications that you can download. And in the case of applications, a lot of them, tend to be available free of charge. Some of these applications that I have got to test and try are, sometimes, open source and free softwares that are available for everyone to use, and also sometimes, softwares that are the result of diabetic patients' initiatives. Perhaps some of you may have heard of this movement called we are not waiting, which was initiated by some of our diabetic peers who with software design skills and who took steps to design the sort of like ideal software for themselves to help them keep better track of their condition. So I highly encourage you to be curious and to try some of these softwares. Of course, I would be more than happy to share with you what my experience was trying some of these, and perhaps invite you to try some with me. And I just wanted to end this part, just giving you a glance at what the future of diabetes management might look like, because I've for many years been a very frustrated diabetic, very frustrated about having to maintain this routine of pricking my finger multiple times a day, filling countless numbers of logbooks, paper logbooks with my sugar readings, and not getting much in return out of all those efforts invested. And I have to say that as I've been trying, a lot of different tools that exist today, it made me much more confident and optimistic about the future, and how diabetes in the future, even though chances are that it will become more prevalent, how the experience for the diabetic patient, will evolve. And over the years, I managed step by step to sort of assemble, try, combine different devices, softwares, that eventually allowed me to today have an eye on my blood glucose on my Apple Watch. And so today, I have a solution which allows me, whenever I need to check where my blood sugars are, to basically look at my watch. And I'm very lucky today, to be at this stage where checking my blood sugar has become, as easy as checking the time. And I'm very confident that at the pace technology is evolving today, this is the type of experience that will, be soon available for most to take advantage of, as there are a lot of moves that we see happening towards enabling better user experiences for diabetic patients. So with that, with that experience and that knowledge, I also tried to make use of this to see how I could get my mom to benefit from this, and because over the past year and a half, so yeah, my mom used to live in France, so 12 hours flight away from Singapore, and while up until now, I used to manage to keep a routine of meeting with my mother 3 to 4 times a year. With the pandemic, there's been like a period of more than a year and a half where we had to be apart, and so it was much more challenging for me, for the doctors, the caregivers, to basically assist her and help her with the management of her condition. So with the help of some caregivers in France, we managed to build the system, which relies on this flash glucose monitoring device that she used to wear, and that's now widely available in France. And combine that with softwares, which in both cases are free softwares to download, to help family and caregivers keep an eye on my mom's blood sugar. And so whenever my mom in France was in hyper state, I would receive notifications on my phone here in Singapore, informing me that she's been having quite a series of highs, and also using some data visualization tools to help the doctors gain better insights into how the blood sugar of my mom have been trending over the several months that basically take place in between the different consultations, and all of this has allowed at the end to enable a better and tighter monitoring and management of my mom's diabetes. And finally, the pandemic was not just about implementing technologies and tools to better track sugars and steps. It also was about trying to break, the isolation that the pandemic has created with families being spread apart. And this is something that we did with my mom and my 3 children that didn't have the opportunity to see each other for such a long period of time. We organized to have my mom read children's storybooks in Japanese and then bedtime stories to our three children in Japanese twice a week. Using Zoom, and this, I have to say, has played a very key role in terms of supporting our mental well-being all, and then that was not just for my mom, who used to live alone in France, but also for my 3 children who were missing those interactions with their grandmother. So these were very precious moments that we got to experience with the pandemic as well. So that's pretty much what I wanted to share with you, in terms of what this pandemic has brought in my life as a diabetic, and of course, I'm more than happy to continue to share about some of these experiences with you, on our upcoming DSG gatherings, if you are interested to find out more. So thank you, thanks for listening, and I will pass it back to Juliana, who will share a bit about some exciting developments coming up for the diabetes support group.
Yeah, thank you, Kenji. We have good news to share with you. Diabetes Singapore is actually having being extended to use the facilities in Jurong Spring CC, that's located at number 8 Jurong West Street 52. So this is actually a support group room. As you can see, it is the safe distance, and actually the 6 are numbered. So you're talking about 20 people in this support group room. Next, please. So this is actually, again, another facility, the exercise and dance room in Jurong Spring CC, that's extended to Diabetes Singapore. Next slide. This is actually the theater in, again, another facility in Jurong Spring CC that's extended to Diabetes Singapore. We are in line, we are part of Diabetes Singapore, and there are actually regular events organized by Diabetes Singapore. And please do look forward to the subsequent events from Diabetes Singapore. Next, please. Okay, there are 2 easy steps to join our diabetes support group and take part in our activities. First, you have to apply as a Diabetes Singapore membership. I am a Diabetes Singapore member. Okay, so this is actually the website. You can you look for the membership application form to fill up. Members, we benefit include discounted medical supplies such as test strip, lancets, and when you sign up as a member, you get a free glucometer. There are terms and conditions that apply. Do read out for that. We have access to screening and services at the various Diabetes Singapore centers. There are 2 centers here, okay, and there are newsletters and events that we can look forward. In the DSG walks, normally after each walk, I do actually write up an article, and that is actually published in the Diabetes Singapore newsletter. Now at this time, we used to have physical newsletter being posted, but now becomes e-newsletter, which are actually available in the website. For new DS members, Diabetes Singapore members, please, they will be added to we have actually a DSG Google group. And if they choose to actually join the diabetes support group, okay, you can actually email me at this stated Yahoo address. And this Google group is moderated. There are 3 moderators, Lisa, Samuel, and Lynn. I normally communicate with Lynn, who will actually, after signing up to the DSG support group, which the link I will email to the new member, she will actually authorize you to join the Google group. So, and moreover, some more I would like to say that we really need a volunteer. But if you'd like to join us as a DSG volunteer, please also contact me. As I mentioned, my forte is in the walks. But for diabetes support group, we are more than that. We want to include other activities like cycling, swimming, painting, more diversified activities. And I want to actually make the participation to be more. Our walks is normally capped at 30 people. Okay, but I wish that we can grow. Now we are restricted during the COVID-19 pandemic. So we are looking forward when Singapore becomes an endemic and when the restrictions are actually released and the walks group numbers are reverted back to normal. Okay, we can resume our walks and physical meetup will be more possible in the various events organized by DS for the support group, and where we can actually use facilities as mentioned earlier in Jurong Spring CC, and possibly in the future, other community centers will be encouraged to extend the facilities to DS as well. The whole purpose of diabetes support group, I want to say, is actually we want to provide a positive mindset to all the DSG members, okay, in living with the condition. Living as whether you're type 1 diabetic or you're a type 2 diabetic, is not an easy journey if you are not in a community. Because in the community, we provide moral support. What is moral support? We are one together and we help to share our success story, and you learn from that. And when the DS events organized, it's not a repeating, when you actually hear, when they actually get doctors, endocrinologists to explain what is diabetes all about, it's a relearning process. And you remind us ourselves ongoing in our journey, okay, to really to continue to improve, keeping all our complications at bay. That is actually the important thing. So diabetes support is very important to us. Please join us. Thank you, and stay safe and healthy in these COVID-19 pandemic times.
Thank you, Miss Juliana. Thank you, Mr. Kenji, for your very useful tips as well as your personal experience sharing. Okay, so I shall now proceed to the key takeaways. Yeah, so for those who are stay attentive until now, thank you very much. And I would like to summarize a few of my personal takeaway. Okay. All right. Okay, what is the most important things that you have heard? Yeah, what I've heard is that Dr. Lee has given a lot of very professional advices, and that there are a lot of tests and health screening that we can go to, proactively. We go and take up those do those health check so that we can pre-detect the onset of the possible, diabetic disease. Okay, but what is most important, the takeaway, is that prevention is still better and cheaper than cure. Yeah, all the speakers agree and also encourage everyone to adopt healthy diet, healthy lifestyle, which includes regular physical exercise. Yeah, also to encourage everyone to go for regular health screening to detect early onset of disease. Okay, and diabetic patients could well manage your blood sugar level. This is from Miss Juliana, by first mentally accepting your condition. Yeah, accept, so that you can find solutions thereafter. Making some lifestyle adjustments, such as adopting a healthy diet, including portion control, leading active lifestyle, doing regular exercise, and also join a support group. And also maintain good emotions, and remember to take your medicine. Yeah, remember to take your medicine regularly. Do not skip your medicine. Diabetic patients could get help from phone apps that Mr. Kenji has suggested. Yeah, so you can keep track your BNI, your blood sugar level, using some of the technology gadgets that help track your glucose level and your daily fitness activities. Yeah, so there are some questions later for Mr. Kenji also to answer. Some of the audience would like to know what kind of gadgets you have used or apps that we have used. Okay, so yeah, there comes to our feedback. Okay, this is the feedback QR code. I encourage you to scan this QR code and take a few minutes to answer simple feedback for us, so that we can serve you better in the future. We can come up with even better sharing later on. Okay, so from your feedback, remember to put in your email address, your contact, yeah, so that we can also send you today's webinar links to the email, and 5 lucky winners will be picked to receive our wellness products, fully sponsored by Lion Club of Singapore, Clarke Quay. Okay, winners will be notified within a week from today. A recorded link will also be uploaded to YouTube for future watching, or for for you to share with your friends. Okay, and okay, now come to the Q&A. All right, can I urge the speakers to or the speakers, would you want to take a look at the Q&A, which I have typed up, the chat that I've typed up all the questions from the audience, or would you prefer me to read it out one by one?
Josephine, can you read it for us?
Sorry, my QR code, I skipped too fast. Yeah, can I go back? I retrace back the QR code. Yeah. Yeah, sorry, I said I'll give you a few minutes, but I'll just I just on a turbo speed. Yeah. Okay, so for the audience, please scan this QR code. You can take 1 minute to a few minutes, while our speakers can read through all the Q&A questions that are posted for you. I gathered from all the audience earlier on. Yeah, so can speakers please take a look in the chat room? Yeah, so our audience, please, you can do the scanning and replying the feedback now. Thank you so much. Okay, finishing up. Anyone need extra time? Is it difficult to answer? You unable to scan the QR code. Okay, we will paste in the chat room right now for you, yeah? When you scan, you can either, okay, this is the link that you can click on. Please go to the chat room. You can if you cannot scan from our screen, yeah, from your computer screen, you can go to the link to click on the feedback link. Yeah. We're not okay. All right. So now we will proceed to the Q&A session. Okay. The first few questions are actually for Dr. Lee. Is Dr. Lee with us? Is Dr. Lee with us?
Yes, Dr. Lee is here. Sorry, it wasn't unmuting. Yeah. So thank you for the nice feedback from panelists. Somebody asked me whether dapagliflozin will cause renal problems. No. Normally, actually, what happens when people with diabetes, their blood sugar levels are high, urine spills out glucose spills out into the urine. In fact, that's the basis of the old-fashioned test for diabetes. You actually did your urine glucose test. And someone had the smart idea that if you could somehow trick the kidney to releasing sugar early at a lower level, when the blood sugar level is normal, you still allow the glucose to flow out in the urine. Because glucose actually represents calories, if your glucose flows out to the urine, you're actually lowering blood glucose. You're actually helping the patient to lose some weight by losing calories. So that's how it works. Since it is a normal phenomenon, if you've got excessive sugar for urine to spill out in sugar, it doesn't harm the kidney per se. But for some people, having sugar in the urine can lead to a higher risk of yeast infections. So that's basically the long and short of it. There is actually quite a lot of literature. In fact, for some of the SGLT2 inhibitor medications, the other side benefits, cardiovascular and renal side benefits. But again, that's a topic that you should go and bring up with your doctor. Most doctors are quite aware of this in the diabetes field. Thank you.
Yeah, and there are more questions for you, Dr. Lee. There's one question asking. Okay, there's one question asking, what is the difference between type 1 and type 2 diabetes?
Oh, okay. I think someone actually answered on my behalf, which is quite correct. In type 1 diabetes, the pancreas is no longer able to make insulin because it has been attacked by an autoimmune process, right? In type 2 diabetes, the primary problem is that there is an insulin resistance. It means you're making insulin, but your body is not able to make use of this insulin. It's not listening to the insulin. So type 2 diabetes is primarily I don't want to listen to my insulin kind of process. But when that happens, the body tries to make more and more insulin. And at some point, the pancreas is trying to make so much insulin that it starts to fail. So at the end point, after 8, 9, 10 years of type 2 diabetes, some people with diabetes start to have lowered insulin production. So therefore, they also end up needing to be on insulin. It's estimated that about 1 in 5 people with type 2 diabetes eventually might need insulin injections. But nowadays, there are more and more drugs and medications which are trying to make your insulin more efficient and also trying to make the body make more insulin. So the DPP-4 inhibitors, the GLP-1 agonists, these are also drugs, the insulin sensitizers like metformin. These are either helping the body to become more efficient at listening to the insulin or actually making more insulin. And basically what happens is when you are no longer stressing your pancreas so much, your body is able to make more insulin and sort of recover, as it were.
Thank you, Dr. Lee. Yeah, I believe you have answered this question very well. There's another question. How many times does the type 2 diabetic patient need to do a home test, perform home test per day?
That's actually an interesting question, which on an individual level is best answered by your doctor, but in a general level, I'll answer this for you. You see, in a type 2 diabetes patient, a lot of people would be just using an oral medication. And people think, oh, but if I'm on oral medication, I'm not on insulin, that means I don't need to test. Because I'm still going to take 1 tablet or 2 tablets X number of times a day. What difference does it make? Well, when you test, you are able to see if your medication is too strong for you. In fact, for some of the medications, it is too strong, and it may cause hypoglycemia, or it may not be hitting. You might actually be high at one point of the day or low at a different point of the day. So even a person with an oral medication regime for type 2 diabetes may benefit from smart blood glucose testing to know what time of day, and what is the situation when you actually get high or low blood sugar. That's why Kenji actually mentioned something about how continuous glucose monitoring has made a huge difference, because many people think that they've done fasting blood glucose or always in the morning and it's always very good. But actually, that just means that either before or after breakfast, you're okay. But if you ate a big breakfast, or you ate a big lunch, or you ate a big dinner, are you still okay after that lunch, breakfast, and dinner? It could be that some people might need an injection of insulin to help them with their blood sugar levels for a certain meal, maybe the heavier meal of the day, or that some people might actually need to have a stronger medicine or not so strong medicine at certain points of the day. So doing spread out pre and post meal blood glucose levels on a typical day, right, may make a lot of difference. So I used to do some work in less developed countries, places like Africa and India. And for those people, even to do 15 or 20 blood glucose tests, that's a lot of their disposable income. They don't earn that much money. So even if you say 50 cents or $1 per glucose strip, that's a lot of money for them. So we teach them to say, you take a look and see what is your problem. You're more likely to get a hypoglycemia. You take your blood test to try and discover when you have hypoglycemia. If you have hyperglycemia, you take your blood test to try and see whether you have a hyperglycemia. If your day, every day of the week is the same, then you take maybe 3 random days, pre-post meal, and that's good enough. But if you've got different timetables every day of the week, then you want to know, hey, on Mondays, what is it like? On Thursdays, what is it like? On the day that I'm exercising a lot, what is it like? On the day that I'm stressed, but I'm sitting in the office, or I don't get to go out to exercise, what is my sugar level like? And you actually use the blood glucose testing, whether it is continuous or finger prick, to discover patterns that you can do something about. You can either change your food, you can change your diet, you can change your exercise. You're using that information to do something. And in so doing, the number of tests required is the amount of information that you require. So if you can get that information from 5 tests, so be it. 10 tests, so be it. 30 tests, so be it. I think that's more a smarter way of doing it, rather than just saying, no, I'm going to do 30 tests every month, but it's always at the same time. It's always before breakfast. You have no idea what it's like before lunch. You have no idea what your sugar is like after dinner. So the 30 tests is not going to be useful for you. You should actually then do, divide it up, those same 30 tests to different times of the day. So the more variability in your life, the more frequently you need to do the test. The less variability in the life, the more you can say random tests at certain specific times still help me to get enough information for me and my doctor or my diabetes educator to help make some informed decisions about what to do to get better control. I think that's more relevant. Thank you.
Thank you, Dr. Lee. Yeah, Dr. Lee, there is a question asking whether a nurse can claim the CPA CPE, sorry, CPE from this attending this talk?
I think it's something to do with whether the nurses, what your procedures are. Normally, these talks, if you want to claim points, you have to work with nursing board. So given that this was a public talk, if there was no prior registration, you may not be able to claim any points. I'm so sorry. But I would just hope it's more informative for you, that's all. Yeah.
Okay, thank you, thank you. Yeah, the next question is for Mr. Kenji. Mr. Kenji, there's a question asking that you mentioned about monitoring your glucose level on your Apple Watch. Yeah, he's asking what type of app did you use?
Okay, sure. Before I answer that question, I just want to make a disclaimer that obviously I'm not a doctor, so I'm not in a position to make any advice, medical advice. I will just share my own personal experience, and also reminding everyone that the sort of solutions, the software that have been working for me may not necessarily reproduce the same experience for everyone. So please do make sure that you are vigilant about always testing how these softwares work for yourself, and always cross-checking that data is consistent on your medical devices. So now, having said that, there has been a lot of rumor recently building up around the fact that in the near future, a company like Apple or Google, who are really specialists at data and who are becoming more and more involved in actually facilitating and allowing health data to be more available through the devices and to flow more easily between devices and softwares. So there is no doubt that this will ultimately benefit the diabetic patient experience. And to me, as a patient, it makes so much sense to have my blood sugar visible just right next to the time on my watch. That I have no doubt that this is how the diabetic user experience will evolve in the future. So I do not have any insights as to how much committed and involved Apple or companies like Apple's are on that front, but generally I can see that there is a lot happening right now. A lot of startup companies trying to work on very innovative approaches, either to measure blood sugar, because everyone's eagerly waiting to see a device that's able to monitor blood glucose in a non-invasive way. This has not happened yet, but perhaps like in the future we may see things like this. But overall, my approach has been to try to leverage what exists, and there is like an abundance of applications that allow you to track your sugar. So they are essentially like logbooks to keep note of your blood glucose. Some of these applications have slightly more elaborate feature, which allows to communicate with your blood glucose monitoring devices, so that you don't have to key in those things by hand all the time. So whenever you check your blood glucose, the data can go straight into your logbook on your mobile phone. So these kind of applications are already widely available. One of them is an app I can quote, which is very popular, which is called My Sugar, that some of you may already be familiar with. But personally, to create the sort of experiences that I shared earlier, I've been using a combination of the Apple Watch, and also one of the famous flash glucose monitoring devices, which is available currently. I think in Singapore there's probably only one or two companies that do that. So you can find out easily what that device is. That device already comes with like softwares that can be downloaded free of charge, which enable like uploading, your blood glucose readings on the cloud and triggering notifications to caregivers. There is also like a data visualization tool. Talking of data visualization, I can probably share with you an initiative which is backed by JDRF. JDRF is the Juvenile Diabetes Research Foundation, which is a non-profit organization. They've been backing a startup initiative called Typepool, which has designed a data visualization tool, which is capable of actually working with a lot of different devices. And using that software, chances are that if you have a device that has the ability to communicate over Bluetooth your blood glucose readings, you might be able to take advantage of that data visualization tool, and this gives to your doctor like much greater insights into how your sugar have been trending over the past couple of weeks, months, whether there are any recurring patterns that deserve taking action on. So that's what I can share. I also have been using a small piece of hardware, which is developed by a Chinese startup company, which I will leave you to research, but which actually helps me send my glucose readings on the flash monitoring device over to my mobile phone. So basically, it allows converting a flash glucose monitoring device, which traditionally requires that you scan the device to get your readings, into a continuous glucose monitoring system. Because basically what that device does is like every 5 minutes it will perform a scan and send that reading automatically on your device. So these are some of the things that already exist today. And just to finish on this, it's not just about data. To Dr. Lee's point earlier, it's also about taking action on the data, and this is like the very important part. If you may have like a device that allows you to see in real time how your blood sugar is trending. If you do not act on it, then there is only a little use to making use of such software. So the action part is probably as important as the data retrieving part. That's my experience.
Thank you, Mr. Kenji. Yeah, and the next question is for Dr. Lee. There's one audience asking that for every intervention, they may have its side effect, right? Would you recommend changing medication from time to time?
That's a very, very open-ended question. What we would say is that a lot of people will start the type 2 diabetes journey with diet and exercise, and then follow on with oral medications. And at some point, your doctor is going to tell you that, look, Mr. or Mrs. So-and-so, the time has come where oral medications will no longer help and you need insulin injections. Now, ask any diabetes doctor and we'll say that this is the hardest part, because most people will not sign up and say, oh, quickly, I volunteer to have insulin injections. Yet we know that if usually somewhere between 6 and 10 years after the diagnosis of type 2 diabetes, very often you will start to see that there's a need for an injectable. This injectable might be a once a day injection, twice a day injection, or even basal bolus injections. If your doctor tells you that you need an insulin injection for your type 2 diabetes, don't run away from it. it is like your, if you drive a car, your workshop manager saying, Mr. Tan, your car is due for servicing. And you say, look, I want to save money. I don't want to service. So it might go on for a little while. Your car will still run, but the day will come when your car will stop working. It will be, you call up the workshop, trying to get the car towed to the workshop, and the guy is going to say to you, Mr. Tan, we told you to go and bring your car in for regular servicing. You didn't want to have regular servicing. Now look at your bill. Do, re, mi, fa, so. You have to go and change all these parts. You have to do all these major overhaul. Now, I talked about cars, but the human body not so different. If we have reached a point where certain classes of medications no longer work, then you actually need to give the body a break. Sometimes people need insulin in type 2 diabetes temporarily. In fact, I didn't have time to talk about it, but there are people who have used insulin injections over a short period of time to actually induce long-lasting remissions in type 2 diabetes, right? And basically it goes on that you need a break. Your body making, your body's processes that make insulin have been working so hard that if you do not give it a break and give some help and give some insulin, then you're going to get accelerated breakdown. But if you give insulin for a while, your system can get back to shape again, and then you might then go back to oral medications rather than large doses of insulin. I think I put it this way because yes, some people need to change from one class of oral medications to another, increase one type of oral medications to another, but certainly in the field of whether it's type 1 or type 2 diabetes, hesitation to go on to an injectable form is one of the reasons why people who previously were well controlled eventually get a lot of diabetes complications, because the Chinese say, 你要认老. And you also have the equivalent. You must recognize the time when your body is no longer able to take oral medications alone. You may have to be on temporary or permanent insulin injections to help. Remember, because it's about making sure that the entire system, the entire body is functioning well. And you cannot let the weakest component cause problems for the rest. And sometimes that weakest component is insulin production. I think obviously that's not answering the full question, but that's answering the most common problem. Thank you.
Thank you, Dr. Lee. Due to time constraint, we will not be able to post more questions. So we only have last two questions for Dr. Lee. The second last question is also from the same audience who asked about these earlier questions that you have answered. He asked that with behavioral habits, change in behavioral habits, even leading an active lifestyle, will it prolong chronic illness falling into palliative care?
Okay, I'm not so sure I quite understand that question, but let me put it this way. And again, it has to do with diabetes prevention. Let's say you have got pre-diabetes. Certainly lifestyle change will be very important. Weight loss, increased exercise, and so on and so forth. But there's this thing called aging. And aging hits all of us, right?
Yes.
So as we age, our machinery starts to fail. At some point, the pre-diabetes is going to become a diabetes, or the pre-pre is going to become a pre. So there are doctors and there are some protocols which say that actually if you are in the pre-diabetes stage, some people would actually put you on medication to prolong the pre-diabetes or the early diabetes stage, because it's all about a continuum. Just as when we talk about aging, when you reach 50, when you reach 60, when you reach 70, when your hair starts to turn white, when you have no more hair left, that sort of thing. It's a continuum, right? So you have to deal with what is missing at every point of the continuum. Some people will age slower, some people age faster, some people will reach a critical point where you have to add or change medicine faster.
Oh, 就是那个 fasting.
Yeah, so I think maybe that's what you are talking about. in terms of palliative care, you know, there's some wise person who said that life is a fatal condition, right? So it's all about making sure that we live long lives and we live lives that are worthy of living, and that we have got healthy lives, not necessarily long lives. And if we need medication or we need lifestyle change to achieve that, then we should. Hope that answers.
Thank you, Dr. Lee. Here we come to the last question for the Q&A for today. Yeah, the last question is from one of the audience. Yeah, the DPP. He's asking that can we control or lower blood sugar by doing fasting?
Okay. Intermittent fasting has been talked about. Now, what does fasting do? Fasting is when you should be eating a meal and you choose to skip a meal. All right. There are some advantages about intermittent fasting. Some people use that to force the body to mop up a lot of half-used components in the cells. It's a bit like cleaning out your fridge by everybody deciding, okay, next 2 days we eat up all the leftovers in the fridge and clean out the fridge. Yes, the body does have a little bit of that kind of component of mechanism. The other thing about fasting is that properly managed, the fasting may help a person to lose weight. But as a treatment for diabetes, you have to be careful for that. The last time fasting was considered a proper treatment of diabetes is exactly 100 years ago, before the invention of, before the discovery of insulin. And at that point in time, the only way that you could actually help people to control sugar was by fasting. But fasting per se does not address the issue of insulin resistance or insulin lack, right? It may reduce the need for insulin because you're actually not eating so much food. But in modern medicine, you wouldn't use fasting as a primary modality. You would, yes, some people do a bit of intermittent fasting or as part of a weight loss regime. But if you're already on insulin medications or you're on oral diabetes medications, be careful, talk to your doctor about that before you do stuff like that. Otherwise, it may trigger hypoglycemia. Yeah, I think that helps.
Thank you, Dr. Lee. Due to the overwhelming response we received from our audience, yeah, today our event has run a little bit behind time. Yeah, it's 9 minutes behind time. So we now have come to the end of our health webinar on the diabetics awareness. So once again, I would like to represent on behalf of Lion Club of Singapore, Club Key, I would like to sincerely thank our 3 speakers for today, Dr. Warren Lee and Ms. Juliana Lee and Mr. Kenji. And I wish everyone a good weekend. Yeah, so thank you very much.
Thank you so much.
Yeah.
Thanks, everyone.
Thank you.
Thank
you,
you.
everybody.
Thank you,
Thank you, everyone.
Last slide will not come. Thank you, everyone. So bye-bye. Have a great weekend.
Bye-bye.
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 Bye-bye.